cardiac troponin and risk stratification in ischemia. My name is Lisbeth Pularin Reyes, Harvard of Medicina, Catholic University of Santiago of Guayaquil, Ecuador. Early first generation and second generation cardiac troponin assays were shown to improve the accuracy of the diagnosis of acute myocardial infarction and the risk stratification of patients with separate ischemic symptoms by means of more precise identification of myocardial necrosis. This video, what is troponin?
One of the major challenges in cardiovascular laboratory medicine revolves around acute coronary syndrome. Although acute coronary syndrome constitutes a continuum, it is usually divided into non-ST elevation myocardial infarction, or MSTEMI, and ST elevation myocardial infarction, or STEMI, based upon electrocardiogram changes at patient presentation. Patients with unstable angina are also classified into the acute coronary syndrome definition and present with chest pain or other symptoms without electrocardiogram changes or evidence of myocardial necrosis. Annual statistics estimate there are 610,000 new and 325,000 recurrent acute myocardial infarctions, with 6 million visits to emergency rooms across the United States. A smaller percentage, approximately 2 to 5%, of myocardial infarctions are missed in emergency rooms. Mortality rates for patients over 40 years of age are high, 20% within the first year following an MI, and 30 to 40% within the next 5 years. Notably, the mortality rate is also higher for females than males. The diagnostic challenge relies on clearly differentiating patients who do have an acute myocardial infarction from those who have not and use essential. Furthermore, situations are often not black and white, and decisions are often needed about what to do with patients who have slightly elevated troponins but aren't changing.
The first universal definition of myocardial infarction, published in 2000, defined laboratory threshold for the designation of elevated cardiac troponin values to clarify the diagnosis of myocardial infarction in a patient with separate myocardial ischemia. This video, what is ischemia, heart disease?
So what is ischemic heart disease? I think the first thing to mention is that ischemic heart disease is very common in the United States. At its very core, it really refers to the buildup of atherosclerotic plaque in the arteries of the heart, so-called coronary arteries. The buildup of atherosclerotic plaque involves many complicated mechanisms in the body, but for the most part, it's a delivery of cholesterol into the wall of the arteries, which leads to a reduction in the size of the lumen, or center of the artery where the blood flows. When this occurs, this can lead to chest pain, we call angina, or heart attack. So the buildup of atherosclerotic plaque is one basic mechanism of ischemic heart disease. There are a lot of other important things at play, such as inflammation, and many other various biochemical markers. If we want to use a simple analogy, it would be clogged plumbing in the house. And unfortunately, it's not so simple to unclog the plumbing and restore the flow. But the good news is that there's a lot of treatments for ischemic heart disease and ways to reduce your risk. It involves healthy choices with diet and exercise, seeing your doctor regularly, and controlling things like high blood pressure, high cholesterol, and smoking. And in brief, I think that's what most of us mean when we mention ischemic heart disease.
This video self.
Ischemic Ischemic heart disease, or coronary artery disease, happens when one of the arteries that supplies the blood flow to the heart muscle is blocked. There's really two main types of ischemic heart disease. One is having an acute heart attack or an acute myocardial infarction, and that occurs when the blood flow to the heart is blocked off suddenly and you have an occluded artery. As an interventional cardiologist, that is really a big part of what I do. Now, whereas an ST elevation MI happens when the vessel is totally blocked, chronic ischemic heart disease is kind of the definition we give when people have vessels that aren't completely blocked but can still give you symptoms. If you're having chest pain and you come to the hospital, which you should do if you're having chest pain, and it looks like you're having a heart attack, our job is to take care of you as quickly and effectively as possible. For me, that's really probably the most exciting thing about what I do. It can happen at 2 in the morning, but you really feel like you're making a difference because you're really trying to save somebody's life if they're having a heart attack.
The given lies for unstable angina and not ischemic elevation myocardial infarction in the United States and Europe, incorporated cardiac troponin.
For those of you who care for patients with heart failure, it comes as no surprise that low levels of troponin in the blood is not a good sign and carries with it a poor prognosis. Now in JACC there is more information on biomarkers of subclinical myocardial injury and hemodynamic stress, this time identifying asymptomatic individuals with left ventricular hypertrophy at higher risk for heart failure and death. The researchers looked at participants in the Dallas Heart Study without clinical heart failure, LV dysfunction, or chronic kidney disease, who underwent measurement of LV mass and also had troponin and BNP analyses. Participants were characterized into groups based on the presence or absence of LVH and biomarker levels above or below a predefined threshold. The paper goes into a lot of group analyses, but here's the bottom line. The interactions between LVH and positive troponins and LVH and positive BNP were highly significant. Individuals who had LVH and either positive troponin or positive BNP remained at 4-fold higher risk for heart failure or cardiovascular death after multivariable adjustment for cardiovascular risk factors, renal function, and LV mass compared with those who had LVH and negative biomarkers.
In conclusion, is the cardiac troponin is favorable in stratification in ischemic. Thank you.